Welcome to Kids Health Revolution Radio with Deborah Morgan. On our show, we'll discuss natural and alternative health approaches to help children who have chronic health concerns. You'll hear from professional health experts and fellow parents who have used these proven methods to improve the health of their children, and you can too. If you have questions or topics you would like covered on the show, please send an email to Deborah@kidshealthrevolution.com. And now, here's Deborah.
Hello, everybody, and welcome back to another fabulous episode of Kids Health Revolution, the podcast. We are back with another day or hour of information, inspiration, and of course, all the tools that you need to take your child's health back, to actually start making a difference in your child's life. And I'm always very excited to talk to my guests that I have on the show and share the wealth of information they have. But I think I'm especially excited today, a very timely topic that we're touching on today, something I've been doing a lot of research into myself in terms of helping my own son, and I have a lot of learning to do. So I am so grateful and so happy to have Dr. Bonni Goldstein joining us on the show today. She is a medical director of the Canna Center's Wellness and Education. It's a California-based medical practice that's devoted to educating patients about the use of cannabis for serious and chronic medical conditions. After years of working in the specialty of pediatric emergency medicine, she developed an interest in the science of medicinal cannabis after witnessing its beneficial effects in an ill friend, which I think is so interesting. I think that's what leads a lot of us to this. And since then, she has evaluated thousands of patients for the use of medical cannabis. She has a special interest in treating children with intractable epilepsy, autism, and advanced cancers, as well as adults with chronic pain, autoimmune illness, and other endocannabinoid deficiency disorders. Dr. Goldstein recently authored the book, Cannabis Revealed, How the World's Most Misunderstood Plant is Treating Everything from Chronic Pain to Epilepsy. She is also the medical advisor to weedmaps.com. It's the first and largest global technology and media company in the cannabis space. She's a frequent speaker both nationally and internationally. Dr. Goldstein has presented her clinical results at the yearly CanMed conference in Boston, Patients Out of Time conference, and the Medical Cannabis Symposium in Sydney, Australia. She's appeared on the TV show The Doctors and is featured in the soon-to-be-released documentary Weed the People, which I'm looking forward to seeing. She's a native of New Jersey. Dr. Goldstein received her undergraduate education at Reuters, I hope I'm saying that right, college, and her medical degree at Robert Wood Johnson Medical School at the University of Medicine and Dentistry of New Jersey. Her postdoctoral education included internship and residency at the Children's Hospital, Los Angeles. She also served as chief resident at the Children's Hospital, Los Angeles. She was a clinical instructor in pediatrics at the UCS School of Medicine in Los Angeles, emergency transport attending physician at Children's Hospital, Los Angeles, and emergency medicine attending physician in the pediatric emergency department at Los Angeles County, USC Medical Center. She is a member of the Society of Cannabis Clinicians, the International Association of Cannabis as Medicine, and the International Cannabinoid Research Society. Dr. Goldstein also serves on the scientific advisory boards for United Patients Group and United in Compassion Australia. So, wow, some huge credentials there, Dr. Goldstein. Thank you so much for hopping on the show and joining us to share your wisdom today.
It's my pleasure to be here.
Awesome. So as we spoke about, I love to just get a little bit of your personal story before we jump into drilling you with questions of what really got you on this path and so passionate about medical use of cannabis.
Well, I was in the world of pediatric emergency medicine, which I loved for a very long time. And then, I had my own child, and I wanted to, of course, be present when I was at home with him. And I was finding that the pediatric ER, the hours, the critical nature of what you see in the emergency department was starting to take its toll. And I lasted a long time, probably almost 13 years and about, a number of years into my son's life. And it worked out for a while because I was working at night and I could be home during the day with my son. But I went through a time where I felt like my sleep and my patience were deprived, and
Right.
I recognized it, and I decided to take some time off. Which it's a funny thing. We had sold a home at the height of the market, and it bought me a few months of what I would call sanity leave. And so I took some time off, and it's so interesting how things happen, for a reason. A friend of mine, um, who I'd known for quite some time, got sick and had asked me about medical cannabis because she was really struggling. And, I didn't know anything. I wasn't taught about it. Look, I was taking care of children in the emergency department, and it just was not on my radar.
Right, of course.
And because I had taken a leave of absence, and I will tell you, I'm a bit of a science geek, so I enjoy science. I enjoy reading about science and learning about it. Always have since I was a little girl. I started reading about medical cannabis to help my friend. And she's not a scientist, and she said, I went online. I don't really understand what this means. Can you help me? And what was fascinating was that despite the fact that everybody says there's no research, there's a ton of research. And the internet gives us a chance to see that. And so I started reading, and I thought, wow, how come I didn't learn about this? How come I don't know about this? And it really piqued my interest. I saw she went, and of course here in California, medical cannabis has been legal since 1996. She was able to go get approved by a physician, and I watched her get some great results. And I think that is something that, a lot of doctors we're taught this is a drug of abuse, but then when you see somebody and love experience tremendous benefits, you say, wait a minute, I need to challenge this dogma that's being taught. And I was intrigued, and I kind of have not looked back. I started working in a part-time in a practice here in Los Angeles. And I'm going to tell you that, one of the reasons I've always loved what I do is you talk to people and you get a chance to help them. And I learned so much in the first, I would say, 6 months of talking to people about medical cannabis. They were sharing with me how it helped them. They were sharing with me the drugs they were able to get off of. They were sharing with me how it impacted their quality of life in such a positive way. And when you see person after person after person giving you that their personal results, they're not lying. If you just listen, and I always tell doctors, if you just listen to your patients, you're going to learn so much. And it was amazing what people were telling me, getting off pain pills, getting off heavy duty drugs that suppress, their immunity because they have an autoimmune disease, sleeping through the night. I mean, just something as simple as that, being able to sleep and feel well when they woke up.
So important.
It is. And that's what, and I knew after those first few months seeing patients that's what I wanted to do. And so I joined another practice. I became medical director, and then I eventually bought the practice, changed the name to Canna Centers, and here we are however many years later. So it's very rewarding. And one of the things I like to tell people is cannabis allows me to practice medicine with that Hippocratic oath, do no harm. This is not harmful. It may not help somebody. Not everybody responds, but there is no harm with cannabis. It either works or it doesn't work, and it becomes pretty obvious after you try it. It's not the easiest thing, of course, because we still have access issues and legal issues, but at the same time, when patients are free to try this, we see some really nice things.
Amazing. And, I'm talking to you from Canada, and some of my listeners are from Canada. I have we have international parents listening to the show, but so, we have our own challenges with access to it, which, hopefully here in Canada will soon be resolved if we move to legalize it. But that's something that I'd like to get into, a little bit in a few minutes. First of all, I think I'd like to maybe see if you could delve into a little bit. I know you've written a book, so I'd like you to maybe talk about, if a listener was to buy the book, does it sort of walk them through how cannabis is helpful for different medical conditions?
Yes, and so the way the book is broken up is first I talk about the endocannabinoid system.
Great.
So very important, and I don't know if you're ready to talk about that,
I
but
am.
that's the first.
Let's do
Okay,
it.
that's the first, the introduction. Because if we don't understand how something works in the body, it's very hard to understand, the potential. So, that first chapter's on the endocannabinoid system, and then the second chapter's on the plant. What does the plant have in it? Why is it so beneficial? What are the compounds? And again, remember, this is not, I still get kind of ticked off when people talk, oh, it's a medical hoax. It's just a way to get, people just want to get high. So they talk about this endocannabinoid system. This is a huge area of research all across the world. There are researchers and physicians who have basically dedicated their life's work, their careers, to investigating the endocannabinoid system because of its incredible potential to be a therapeutic target, to be the focus of healing people. So, and then just to answer your question about the book, and then I talk about there's a chapter called How to Use Cannabis as Medicine. And it goes through kind of how cannabis can be available, different ratios, CBD, THC, and we'll talk about that.
Great.
But also it talks about, I have 28 ailments that are listed, and I tried to be succinct and not inundate people with too much information. It really is a book to just introduce, but the ailments range from, anxiety all the way to, and it's alphabetical, and so you can find your ailment, and basically what the ailment is, why it might respond to cannabis in terms of what has the research shown. And I summarize the research, and then I give what I have found clinically with my patients, and also a few tidbits about maybe pointing people in the type of cannabis that they might use. So
Awesome.
I do try to include some of that. Of course, it's not supposed to substitute for professional advice, but at the same time, it does answer the questions of why a certain ailment might respond, and maybe where somebody might begin. So
Oh, that's awesome. I think it sounds like a great resource for people who are looking for exactly as you say, how does this work? What illnesses can I use it for, and what kind am I looking at using? I think those are all the questions that I definitely have had as I'm doing my research, because as you say, there is research out there, and I've dug into the research, but it gets a bit overwhelming, and knowing, how to break it down just as a regular, ordinary, everyday parent, how to break it down and know like how I can apply this and use this for my kids. So wonderful.
Right.
So at the end of the show, we'll make sure that we tell listeners where they can get the book. But let's jump in a little bit to that endocannabinoid system. Such a fun word, that actually.
Yes, it's a mouthful.
Yeah.
So the endocannabinoid system was only discovered in the late 80s, early 90s. So we're talking 1988, 1992. So I'll get into the history. So, of course, cannabis has been used for thousands of years as medicine, and it was only really after about 1930s that it was made illegal. And, I don't want to waste time talking about that, but there's lots of information online if anybody's interested in why it was made illegal. It was really a political decision, financial greed, as they say. They needed to get rid of the hemp plant in order to use other products in our lives. So, what's wrong with hemp? But certainly, we were prohibited from growing it here in the United States for many, many years. Yeah. At the time it was made illegal, nobody knew about cannabinoids. Except for a few scientists, nobody knew about the endocannabinoid system. So it was not made illegal based on the harm to human health, because nobody really understood that at that point. And in fact, even I summarize it in the book, there were study after study before 1930, and then there was a study commissioned here in the United States in New York State by Mayor LaGuardia in New York, who found in the 1940s no harm to human health. In fact, the people who took it in the study liked it. So, but it continued on this path. And so really where the story begins in terms of finding the endocannabinoid system was with Dr. Raphael Mechoulam and his group in Israel. Dr. Mechoulam is a PhD who was interested in using plants as medicine. And in 1964, his group found isolated THC from the cannabis plant. And remember, what they were doing was they were looking to see what compound in the plant caused the intoxicating effect. and they were able to isolate THC. They isolated CBD, and they isolated about, a number of other compounds, I think up to 12 compounds. And they gave these isolated compounds to young, healthy men. And they were able to determine that THC caused the typical effects of what happens when somebody smokes pot, for instance, the high, the munchies, and feeling sleepy, and so on.
Right.
Now, CBD, when they gave it, again, isolated away from all the other compounds in the plant to young, healthy volunteers, didn't do anything. But what happened, remember, in the 60s, this was kind of the run-up to the true illegality here in the United States. Of course, the Controlled Substance Act was passed in 1970 with President Nixon, despite the fact that a commission at that time also found that it's not dangerous and it should not be an offense. It was put in the most strict of the drug restriction categories. And that Schedule 1, we have to remember, means no medicinal value, which is not true, high abuse potential, which is not true, right? And high addiction potential, which is not true of cannabis. And I will say that it is true of alcohol and cigarettes, which are both not even on the the Controlled Substance Act, which is quite frustrating to me. But there it remains. In 1988, a scientist who was trying to figure out how THC made people intoxicated. So we knew it was the compound that made people intoxicated, but nobody really understood the mechanism. And you have to remember that between 1964 and 1988, the scientific tools that researchers could use expanded tremendously. So we have electron microscope, we have radioactive dye we can follow, we have CAT scan, we have all these types of tools now that we can actually see into the brain. That we did not have in 1964.
Right.
So this was a Dr. Howlett out of, I believe, Maryland, who took some THC. And by the way, she was not allowed to use real THC. So she used what's called synthetic THC, whipped up in a lab, a synthetic laboratory-made compound, not the compound made from the plant, again, because of the restriction on using the real compound.
Right.
And she put a radioactive label on it, and she followed it in the rat's brain. And what happened each and every time was that THC compound found this particular receptor. And so what are receptors? Receptors are locks that sit on a cell wall. So if we go back to cell biology back in high school, remember a cell, it's a little round circle and it has some stuff inside, including our DNA and some other mechanisms in there. But on the cell wall, kind of like a door to a room, is sitting a receptor, and that receptor acts like a lock. And what happens is every receptor that we have in our body has a key. So we have serotonin receptors. The key is the compound serotonin. We have opioid receptors. Now, we do not have opioid receptors for opioids that the doctor prescribes. We have opioid receptors because we make compounds called endorphins, our feel-good chemical.
Right.
So we are supposed to release those to help our body with pain and with feeling good. We have dopamine receptors because we make compounds called dopamine. So what was interesting was that this particular receptor that they found, was actually called an orphan receptor because nobody knew what the key was. It was still unknown. So Dr. Howlett and her group puts radioactive THC or radio dye labeled into these animals, and she sees that the THC binds to this orphan receptor. And so they changed the name of the receptor to a cannabinoid receptor. What's a cannabinoid? Cannabinoid is a compound that fits a certain definition, but it comes from the cannabis plant.
Right.
So that's 1988. And of course, these scientists were very bright, and they said, well, we do not have any receptors in our body for keys that we do not make. Yes, or Mother Nature
There's
makes
a reason.
Right? There's a reason that it's there, or it would have evolved out.
Right.
So they went in search of, looking for maybe the key that we make. And it turns out it took 4 years. And part of the reason it took 4 years was because they were looking for a water-soluble molecule. And it turns out that we make what we call our inner cannabis, an endocannabinoid, endo from the Greek word within, an endocannabinoid, kind of like an endorphin, right? Endorphin.
Right.
And we make our own endocannabinoids, but they're fat molecules. They're not water soluble. So it took
Oh, the
them
fat
some time
soluble.
because, the chemistry needed to fit the compound. So it turns out that now we know at least 5 different endocannabinoids. Only 2 have really been researched in depth. They named the first one that they found anandamide. Ananda is the Sanskrit word for bliss, which I thought was kind of cute that the scientists did that.
Yeah.
But it turns out that we make our own natural inner cannabis. Now, why do we make that? And so what happened was, after they found this, they went in search of what was the role. Why would we make this? What happens? And so this is the mechanism. If a neuron, let's say a brain cell, is sending a message, and our brain cells send neurotransmitter messages, serotonin, dopamine, acetylcholine, all kinds of different neurochemicals, so that one cell is talking to another cell. And by the way, I learned in medical school, and I went to medical school between 1986 and 1990, 4 years there, right when they were discovering this. So I didn't learn about it in school because nobody knew to teach it to us.
Not yet. Yeah.
Not yet. But what happens is one neuron talks to another neuron, sending a chemical message. So I like to use the analogy: I'm watching a movie and it's a chick flick, and the couple breaks up, but then when they get back together, it's romantic, and I all of a sudden have tears of joy, like, oh yay, they got together, and I start feeling this emotion. What's happening is that we're very complex creatures, and I'm watching this movie, and my emotional part of my brain is triggered.
Right.
And it's sending the message to feel so much joy that tears run down my cheeks. So what is that? That's just chemicals. That's a chemical message.
Right.
And so, as I learned in medical school, that the chemical messages only go in one direction. So one cell talks to another, a sending cell talks to a receiving cell. The receiving cell then turns into a sending cell to the next cell, and it's a one-way street. And it turns out that our endocannabinoid system is the feedback loop.
Oh.
So let's say the sending cell is sending too much message, which causes massive firing, and it causes a seizure.
Okay.
What is supposed to happen, though, is that the receiving cell is supposed to see, oh, that's too much message. Let me send a chemical messenger back to that cell in
Slow
reverse.
down.
Feedback. Hey, turn it down. Wrong message. Turn it down. And that's how our endocannabinoids work. It's the receiving cell sending what we call a retrograde, a backwards chemical, that then goes to that receptor sitting on the sending cell. The key fits into the lock, and the cell is supposed to turn off sending so much message. And another analogy I use is, let's say my son, who's a teenager, is in his bedroom, and he's cranking on his guitar, and the amplifier's blasting, but the door's locked. I have to put a key in which it's not, but I don't let my son lock his door. But for this analogy's purpose, let's say he has his door locked. I put the key in the door. If I'm just knocking on the door, I can't get him to turn it down. He can't hear me.
Right.
I put the key in the door. I open the door. Hey, Jake, turn it down. That's basically what's happening, is that message is being sent out, and you want your body to be able to respond. And I love this analogy too. We are on your brain is or in your body is a boat on the ocean, and it's calm, but then this wave comes along and it tips you. You want to get right back into balance. And so what this endocannabinoid system is doing is saying, stop sending the wrong message, go back into balance. And we call that homeostasis. And so the role of the endocannabinoid system, to be less long-winded, is to basically, its role is to maintain homeostasis of the cell's message. It's a signaling
communication.
Exactly. And so think about neuroexcitatory conditions. So autism, Tourette's, ADHD,
Anxiety. Does that fall in?
Seizures.
Right.
Anything that's sending an imbalance. And we know also that these cannabinoid receptors, by the way, they're located in the areas of the brain that control pain, appetite, emotion, motor coordination, nausea, vomiting, pleasure and reward, memory and learning. They're just about everywhere in the brain. Now, they're not located in the part of the brain that control heart rate and breathing. And this is why there are no fatal overdoses from cannabis, because it will not turn off no matter how much you take. And my friend Dr. Sulak in Maine says often in his lectures, scientists have been trying to kill primates for years with cannabis, and we just can't do it.
Can't do it.
Can't do it. And in fact, I just saw a wonderful lecture by a veterinarian who said that animals have received over 3,000 milligrams of THC, which isn't even close to what human beings are taking. I mean, most human beings take 5, 10, 15 milligrams.
Right.
They've given animals over 3,000 milligrams with no fatality. Yes, the animals will be under the influence. They will be sleepy. They will be, they walk like they're drunk.
They might have a bit of a bad trip, but they're not going to die from it.
But there's no fatal overdose.
Right.
And so we're designed that way. And I feel like that's very impressive to think that these cannabinoid receptors are in a lot of places in the brain, but not in the place that can kill you.
Indeed.
And remember, too, that the cannabinoid receptors are also heavily located in the immune system, okay, your white blood cells, your spleen, and also located heavily in the gut. And remember, when we talk about our internal environment meeting up with our external environment, the gut is a very clear picture of that. When
Absolutely.
we put things into our body, it's the external coming inside of us through the gut. And the reason that the gut has so many cannabinoid receptors is because we are constantly challenging the gut, constantly. Right. And we have to maintain balance somewhere. So when I talk about the endocannabinoid system, I'm talking about brain, I'm talking about gut, I'm talking about immune system. There are receptors elsewhere in the body, but those are the main places. Oftentimes when I meet with people in my practice, they'll tell me, you just described me. That's exactly me. Brain, gut, immune.
Wow. Yeah. Well, yeah, and I talk about that a lot on the show, that all of these, the gut is very much connected to, all my listeners have heard me go on and on and on about the gut and how it's connected to the brain and the immune system and all these other things. So this is just another piece in that puzzle, right?
Absolutely.
So let me just make sure I have an idea that's sort of coming out of this, sort of a way that I'm seeing it, and I want to make sure that I'm on the right track. Of the cannabinoid system in the body and the endocannabinoid system in the body being almost like a modulator. Would that be correct? Like it's sort of modulating the communication that's going on. Like, we need to back off on this. Would it ramp up production of anything, or does it only cut back on production of things?
No, it also ramps up. So
Okay.
what I tell people is that if you're in an autoimmune type system where your body is overreacting, right? It's like somebody flipped the switch and your body won't back up. You have too much inflammation. There's too much message, right? But also under. So we can get, and I think a modulator is a wonderful term for it. In fact, there are some initial studies that from back in the 70s, 80s that showed that cannabis may be what we call an immunosuppressive. And I hear that all the time now because it's in the literature. But really what it is an immunomodulator, because we have found that it doesn't really cause people to have a suppressed immune system. It causes, if you use cannabis, most people find that their immune system is actually balanced. So we call it a physiologic regulator. That's really the best way to term it. But I love the word modulation too, because it really is, if you're in an overstate, it kind of cuts back. And that's the most common. But it also does help with, if you're in an under type of state, a hypo state, it does seem to bring that up to balance too.
Okay. Awesome. Well, that was a great explanation of it. I think I love your analogies and how it gives a really great picture of how that's happening in the body, and the fact that this is just, it's these cells that we have all over our body. There's a reason that they're there. Now I know that one of the questions that I get, I've gotten from a few people as I've talked about doing this interview was about the difference between using, like, say, a CBD versus a THC, and then also a difference between using a hemp-based CBD oil and one that's the cannabis plant, if there's any difference, and if you can sort of clarify some of that confusion.
Sure. Right. So let me start with the first part and then remind me if I don't get to the second part. So THC and CBD, they look almost alike when you look at their chemical structure. And again, cannabinoids are compounds that tend to have 21 carbon atoms, and they're arranged in like a ring, a 3-ring type of structure. And if you go on the internet and just Google THC structure, you'll see what a 3-ring molecule looks like of THC. And CBD looks very similar, but there's enough difference in them that they work differently. So THC is a compound that binds directly to the receptor. It is truly the key to the lock. Again, it mimics the anandamide that we make in our body that binds to that receptor. I often call THC a monogamous molecule. It is married to that receptor. It is not interested in having
relations with other receptors.
Relationships with other or interactions, not only just with other receptors, but any other type of mechanisms in the body. CBD, it's interesting, and I stole this. I can't take credit for it. I saw it in a journal article, and I thought it was brilliant. CBD is what they call a promiscuous molecule, and we all giggle about that word, but the reality is it has multiple places where it works. CBD works not only to help at the receptor site. So when CBD actually impacts the way that THC binds to the receptor. It changes the way that THC binds, so it can alter how THC works. And one good example of this is that if you take THC by itself and you're a naive THC user, you've not used it a lot, you're going to have an intoxicating type effect. Right. Now, there are very low doses at which that won't happen, where you're just kind of, triggering the receptor. But in general, let's say someone who's looking recreationally to use THC, you're going to get an intoxicating effect. Right. When you add THC to the mix, it changes the way that add CBD to the mix, it changes the way that THC binds to that receptor, and it dampens down that intoxicating effect. So it does alter the way THC attaches to that receptor. But CBD, in terms of its direct binding to the receptor, no, it's not it does not bind to that receptor. So it works at other receptor sites, what we call non-cannabinoid receptors. It also, and one of the receptors it works at is the GABA receptor. And we all know GABA is a kind of a calming neurotransmitter, right? And so that's why CBD is an anti-anxiety type of molecule. Right. CBD also works to change the way our ion channels work. So in addition to having receptors on our cell wall, there's also these little channels. And they look like little bridges or little openings, and calcium and potassium and sodium flow in and out of our cells. And of course, that's all highly complex and regulated. But CBD changes that. And we know that CBD impacts the way calcium flows in and out of the cell, because that's one of the main ways it works for seizure reduction, is that it changes the calcium, the imbalance of calcium flow, which is inherent in part of the mechanism of seizures, of the origin of seizures. Okay. We also know CBD works as an anti-inflammatory by blocking certain production of certain pro-inflammatory compounds. CBD also blocks something called reactive oxidative stress, which are like the formation of free radicals. Right. And so that's how CBD works as an antioxidant. So CBD is what we would call a polytarget. It has multiple different places in the brain and in the body where it works. And it's interesting because people say, how can CBD do so much? How can it, stop seizures, lower anxiety, be an antipsychotic, be an anti-inflammatory, be a neuroprotective? Well, it works at many different places. And and that's amazing, right? I mean, it's an amazing compound that Mother Nature has given us in the plant. Absolutely. Now, of course, it doesn't come in Mother Nature as a single molecule. It comes packaged in this plant that has over 500 other compounds packaged in there with it, including THC. And so that's the difference between THC and CBD. And so when I have patients that come in and it appears to be a true receptor problem, where I think really that the person's not making their own endocannabinoid, and we want to target that receptor, I may lean towards more of a THC, or at least include THC in the mix of the cannabinoids that I might recommend for somebody. But for some patients, so what I have found, the patients who respond best to the high CBD, very low THC are some patients with seizures, not all. Certainly, patients that have schizophrenia appear to get a very a beneficial effect from high CBD, low THC, although sometimes we add in THC into the mix because it really works directly at that receptor to calm anxiety right at the moment. And also some patients with true inflammatory conditions. So, but again, we're talking about a very complex system, the endocannabinoid system. The way I've described it is this receptor and so on. It's certainly much more complex than that. So it's not a straight line. Oh, you take CBD and you get this result. Our endocannabinoid system is under genetic control. So we all vary the same way our hair color, our eye color, our response to every medicine and every food that we put in our body varies from human to human. It's the same thing with the endocannabinoid system. And I say in my book, my endocannabinoid system is different than yours. We can both have a manifestation of, let's say, anxiety and depression, but I respond to THC and you respond to CBD. It really is a true individual preference in the way that these compounds, and when I say individual preference, I mean like genetically coded.
Individual preference,
how you react to this.
And so does that mean that it's a little bit of a, excuse me, losing my voice, a little bit of a sort of an experimentation at first to find the right balance for each individual?
I would say yes, and I it's funny, the word experiment always sounds like Frankenstein, but the reality is it's trial and error. But how is that any different from a child that I take care of who's been on 17 different medicines for seizures?
Absolutely.
Or a patient who comes to me who's tried Prozac and Wellbutrin and all these other medications and said, it just doesn't fit, it doesn't feel right, I don't feel good on those medicines. So the beauty of cannabis is, again, there's really no downside and there's no withdrawal. If you don't like what you're taking, you can always stop it and move on to the next thing. And the complexity, and I was talking to a family this morning and I said to them, I know it's frustrating to try to find the right strain of cannabis, the right combination of compounds in any particular strain. But the hope is, I always have hope because likely there is something out there that's going to fit. We just have to find it. And so it's a little tedious process, but it is, and I explain to every family that comes to me, it is a process. It is not one size fits all. Some families, their kid is seizure-free from the first dose of CBD oil. That child is a good responder and likely would respond to any CBD, but we got lucky and it was the first product. That's not the typical, but there are cases of that. But I tell people, hang in there, because if you try a few different things, we may really hit on the right thing.
That's really an important message right there. And I want parents to make sure they hear that. It's not simple.
Yeah, it's not simple, but also it's hopeful, because there's so many different things to try and it can take some time, and we all want it better tomorrow, right? Today, actually. But at the same time, there's no harm in trying these different, like what we call strains. Really, strain is a funny word. A brilliant doctor by the name of Dr. Ethan Russo, he wrote the foreword to my book. He's a neurologist. He is what I would call probably, the walking encyclopedia of cannabis. The man really knows quite a bit about this. It's been his life's work. He talks about strain. The word strain is not really appropriate. A strain is what happens when you hurt your back.
Right.
Kind of funny. Yeah. It's the chemical variety. So and the term we use is chemovar. Okay, the chemical variety, chemical var variety of the plant, the chemical makeup of the plant. And these plants are genetically different, just like we are as humans. It's really kind of an amazing thing. And people are constantly crossing the different strains and making different makeups. So I never give up on anybody, because I feel like we can try to find somebody who may have that strain out there that would work for someone's particular condition. Now, I do want to answer the question between hemp. What's the difference between hemp
please.
and CBD from hemp or the CBD from marijuana. So here in the United States, I'm not sure in Canada, but here in the United States, our government back in the 1970s came up with an arbitrary number to define hemp versus marijuana, for
Same
lack
in
of a
Canada.
better term.
Yeah.
Right. Okay. And so that number is 0.3%. So 0.3% THC and higher is considered the drug variety marijuana, the one you go to prison for, the federal felony. 0. And under 0.3% is considered what we call the fiber variety plant, the hemp plant. Okay.
Right.
And so when we look at the plants, they look different. The fiber variety plant has a very small flower. It's grown mostly for its seed and for its stalk. The plant is putting energy into the stalk and into the seeds.
Okay.
The drug variety on the other side of the line is a plant that puts all its energy into the flower. And what,
Right.
for lack of a better term, when I was growing up, they didn't call it flower, they called it the bud.
The bud,
But it's,
yes, right.
But the correct terminology is the flower. And if you go online and you take a look at what a cannabis flower looks like, I mean, I had no idea. I had seen what pot looked like in high school and in college, but, I didn't know what that flower looked like. And it's this big, robust, chunky flower. Okay. And if you were to look up close at the flower, what you'd see is the little hair-like structures that we call trichomes. They almost look like little antennae. And if you were to squish one of those in your fingers, if you could, which you can't because they're so tiny, but if you squished it, you'd feel this resin or this oily substance in there. And that is where the cannabinoids are being made. That's the factory. The trichomes are the factory.
Okay.
Okay. And what's happening in that big flower is that the plant is putting out a large number of cannabinoids, okay? But also making a large number of what we call terpenoids. So terpenoids are the essential oils in the plant that give it its odor and its taste.
Okay.
The hemp plant does not make a lot of terpenoids. The hemp plant, the factory in its flower makes a little bit of CBD. And it really doesn't make a lot of the other cannabinoids. And we're talking about almost 100 other cannabinoids. So the hemp plant seems to be devoid of those. It seems to be virtually devoid of all the terpenoids. And then there's another group of compounds called flavonoids, which are found in the cannabis flower of the quote marijuana variety, the drug variety. And by the way, I call the drug variety the medicine variety because that flower is chock full of compounds that are medicinal, and they are synergistic and they work together. The cannabinoids and the terpenoids and the flavonoids all kind of work together to give those medicinal benefits and to balance each other. And so if you were to look at the hemp plant, it's just not a very robust source of drugs, of medicine. It has a little bit of CBD. Now, if you take the molecule CBD out of the hemp plant, let's say, and you take the molecule CBD out of the drug variety, yes, they look alike. But what makes CBD so powerful as a medicine is not just it by itself. The single molecule by itself has a very narrow therapeutic window. Right. But when it's found in the whole plant with all the other compounds, all the other cannabinoids, even a little bit of THC, all the other terpenoids, the flavonoids, the therapeutic window widens, meaning you can get a much better result, and it's a much more robust source of medicine than the hemp. Now, that being said, there are now people growing, I'm sure, all over the world, but here in the United States for sure, I'm sure in Canada, where they're growing, it's not such a fine line that our government draws, it's this number of this amount of THC higher or lower. There's a gray zone in there where, there are people who cross a drug variety strain with a fiber variety strain, and their plant's very low in THC, but it has all the other compounds. Now, that may be good for a child with epilepsy. In fact, I see children who are seizure-free on, quote, hemp oil. But what's in the hemp oil? It's not just the name. It is what is in it. And what I tell people is that I don't care if you call it hemp. I don't care if you call it drug variety. If you get a test result and you can see a robust source of multiple cannabinoids, with CBD being the dominant one, but there's still THC, there's still CBG, CBC, and some of these other compounds that are in there. You see terpenoids, and they usually don't check for flavonoids, but if you see this kind of well-rounded, robust, multiple compounds, it may work as medicine. Just CBD by itself from industrial-grown hemp, I have seen it work in some patients, but it certainly is very narrow therapeutic range, if what you ask me. So I tell people, buying hemp online,
right,
that's not enough information. You want to see test results, and any company that says we have test results and they're transparent about it, you can at least look at what you're getting. You have to do your research in terms of that.
That's great. That's valuable information. So dig into that research and see what's in there, the test results, what the compounds are.
If somebody says it's proprietary, I say baloney. Move on.
Yeah.
Yep.
Yeah. Okay. That's very helpful. Thank you. And so on this line, a question occurs to me. I did read something that, and I don't know if this is true everywhere, but that the prescription that people get if they go to their doctor and ask for a prescription for medicinal marijuana, that the prescription that they usually get is a synthetic isolated compound. Can you speak to that at all?
Sure. So there is a drug called, I think the brand name is Marinol, or Dronabinol is the generic name. It's a synthetic THC. It's a single molecule compound, so it is THC isolated out. It's synthetic, but it would be like pulling THC out of the plant,
right,
and leaving all hundreds of other compounds behind.
Mm-hmm.
It can work, and in the United States, it's indicated for nausea and vomiting or poor appetite associated with chemotherapy.
Right.
And it's also, the other indication is for HIV wasting syndrome, which we really don't see anymore because the HIV drugs are so good at preventing someone from progressing to that point, as long as, obviously they're diagnosed and treated. But it also, I've seen it off-label prescribed for people who have some chronic pain.
Okay.
Again, that's not an indication, it's just an off-label use.
Mm-hmm.
THC by itself can work for some people, but many people find that it just doesn't work that great, and that it also, remember, it's a pill form, so of course if you have nausea and vomiting, you're swallowing this pill and you're waiting for your body to absorb it, which it may not, especially if you're on chemotherapy. Like, I've had patients tell me, I've taken a big dose, doctor, I don't even feel it. Well, it's because they're not absorbing it.
Right.
But what about just holding it down if you're throwing up?
Exactly.
How is that supposed to help you? Plus, it's expensive.
Right.
But what's interesting about it is that for some people, it causes a severe, what we call dysphoria, which I kind of mentioned before. Dysphoria is this uncomfortable high feeling. You do not feel good from that. Mm-hmm. It makes you feel like time has stopped, and maybe we call it this perceived sense of doom, or a perceived sense of harm. You feel like you're dying.
Does not sound fun.
Yeah, no, it's very unpleasant. But in general, and it's interesting, there's a professor emeritus at Harvard by the name of Dr. Lester Grinspoon, and he's written about Marinol versus the natural plant. And in his experience, he found that across the board, almost 100% of people who have tried both prefer the plant over. And part of it is because the plant contains these other compounds that help modulate how THC binds to that receptor and the effect that you get. And for most people, if you overdo THC, of course, you could get dysphoria. But when there's these other compounds, including CBD and the other terpenoids, it kind of dampens down the over psychoactive effect that one can get. And it's just a more balanced way to take THC. So I tell people, I've used Marinol in some of my patients who do not live in California. I've done some consultation with, for instance, there's a young lady I take care of in Wisconsin who started using CBD, and she was able to get a good quality, quote, hemp version. Again, remember, it was a robust source. It had other cannabinoids and terpenoids in it. Mm-hmm. It just happened to be low on the THC, but it's basically the drug variety bred down on THC.
Right.
But what's interesting is it was helping her with seizures, but it was aggravating behavior, because for some people CBD can be overstimulating, especially children that have some already pre-existing behavioral stuff. So kids with autism. Some families don't even know that their kids have behavioral stuff because they're on so many drugs that it's all kind of squashed, the
Right.
child's personality, any type of behavior. And as CBD helps with seizures and they slowly wean their kids off these drugs, they start to see these behaviors that they never saw before. Well, it's because the seizure medications were dampening down the entire brain, not just seizures.
Right.
And so they're seeing their child's, some of the behavior stuff. And at times we'll add in THC to help kind of calm that down. And again, there's a combination of CBD and THC for some patients that can be, like 15 parts CBD to 1 part THC, or 6 parts CBD to 1 part. I even have some kids on a 1-to-1 ratio where they're getting the benefits of CBD for the seizures, and then they're getting the benefits of the THC for either autism or some other behavioral stuff.
Mm-hmm.
Now, here's this family in Wisconsin. They have no access to any, quote, marijuana products.
Right.
They just can get a hemp. But in a handful of patients, in fact, and also another patient that's in Massachusetts prior to the new laws where now they can access cannabis, I got on the phone with the patient's psychiatrist or a doctor who was willing to prescribe THC. They're not always willing to do that, but they would prescribe the dronabinol so that we could add it in. And again, remember, we're mixing it with CBD. We're not giving it just by itself. So there is some utility in using the synthetic THC in cases where someone is already finding some good result with CBD, or if we want to combine them. I don't ever prescribe it as a drug by itself because I live in California and we have cannabis here, so I don't necessarily.
You don't need to rely on it. Yeah.
But
so if you live somewhere where you can get access to the full, you should make sure when you're talking to your doctor that you're asking for the full plant variety versus the
right.
pharmaceutical prescription, so to speak.
But one thing to say about that, I would add in, so there is likely here in the United States, I don't know in Canada. I know in Canada you guys have a drug called Sativex that's available. Have you heard of that?
Uh-huh.
Yeah, so that is a pharmaceutical company makes a THC CBD combo in a 1-to-1 ratio, and it's been approved in multiple countries, not in the United States, but in multiple countries for the spasticity associated with multiple sclerosis and also for advanced cancer pain. It comes as a spray. You can spray under your tongue, and it's got some peppermint flavor and some alcohol in there. It's like a pharmaceutical concoction, but it does work. And the beauty of that particular product is that they were able to do clinical trials because it was made by a pharmaceutical company, and there was this allowance for the clinical trials, and it does work. And there is no tolerance to the THC. It appears CBD helps buffer some of the tolerance to THC, and there are patients who find that it's very helpful. It does have some burning and under the tongue because there's alcohol in it. So, but in terms of clinical results, there's clear-cut clinical trials that show that it works, and of course it is available, like I said, in many countries. We don't have it here in the United States. The same pharmaceutical company, though, has designed a CBD-only pharmaceutical grade that they use CBD from plant. Again, like a single molecule, they pull the CBD out of the plant chemically, and they've put it into a pharmaceutical concoction that is likely going to be approved here, I would think, probably in the next year or so. And the indications are intractable epilepsy. Okay. And it's interesting that people ask me, what do you think? It's a 98% pure CBD. So similar to what somebody might find with a pure hemp that doesn't have the robust whole plant makeup.
Right.
But this is what I say is, if it works for your child, fantastic.
Right.
I'll take it. But it may not work for every child, and that is why whole plant cannabis oil needs to be available.
Right.
All options on the table for a sick child. I don't have a preference. And certainly if it works and your insurance company will pay for it, hey, great, wonderful. Yes. But it cannot be the only option because there are patients who've used it and it didn't work. And the same thing with whole plant cannabis. Maybe if your child was on whole plant cannabis oil and it didn't work for them, maybe down the line you'll have an option of this pharmaceutical. That would be great. Let's see.
Let's do that, yeah.
Yep. So to me, there isn't, people always say, well, what's better? And it's such an interesting question. And to what I say is, what's better is what works.
Exactly. It goes to that individuality that we spoke about earlier, right?
Yeah. It's not one size fits all. We have to be open to different options for different people, despite the fact that the little diagnosis box is the same, right? We check off that diagnosis. Just because that's the same does not mean that the way you respond is the same.
Exactly. Awesome. Well, I am very sorry to say that we are quickly running out of our time, but I want to make sure that I ask this question. You're talking about patients who live in other states from you. Do you also work internationally with patients?
Yes, I do. Right now, unfortunately, I have a waiting list, but certainly cases of children with cancer or very critical illness, I will make an exception and try to jump to the line. It's very hard to do that, of course, because I know there's a lot of sick kids out there and sick families with sick loved ones. But certainly, I've been. I don't ever want people to have to reach out to me at the very end of the line, because certainly, when introduced earlier in the course of treatment, we can hopefully, not have to get to that point.
Right.
So I do consults. I'll do Skype for international, and then I can do phone consultations. And one thing people have to remember, though, is that the where I have my medical license in California, in order for me to give you what's called a recommendation letter for medical cannabis use, you have to be a California resident, because that's what the law says, and where I practice medicine. But in terms of consultation, I can do it. I often tell people I don't want you to pay my fee and reach out to me if you do not have access, because it makes no sense to me that I can tell you, well, I would recommend this, and then you don't have access. Right. But what I'm slowly finding out is, whether legally or illegally, there's a lot of people that do have access, because I find that human beings are kind in general, despite what we see on the news, and people who are interested in cannabis, who grow it, they are always willing to help families with sick children. They're always willing to help people with cancer, people who are suffering. I'm always amazed by the kindness of people who are willing to break the law to help others. As a doctor, I try to be ethical and professional, and I don't condone breaking the law, but there's a group that I work with called Patients Out of Time. Well, you know what? That's kind of what happens, is that people don't have time for the politicians and the laws to change. And so, I'm usually willing to work with people. Say, well, I can get it. I say, okay. It would be nice if it could be tested, so we know what we're working with. I don't want to just have you take anything, but at the same time, I try to work within the confines of what we have to work within,
Absolutely. Yeah. Until hopefully some of these things start to change with the more and more research that comes out, hopefully.
Right. And people should advocate. The reason that laws have changed in the United States is because moms and dads got on the phones with their representatives. They showed up at hearings. They showed up at legislative discussions and said, I demand this to be available for my child. You cannot take this. You're not allowed to deny this to my family. You're depriving my child of life-saving medicine. And it has changed the laws. So I encourage people to advocate for their families and to advocate for other families who are struggling.
Absolutely. It's that grassroots movement, right?
Absolutely.
There's a lot of power there.
No pun intended, right?
Yeah, right. Exactly. I didn't even see that, but good one. Awesome. Well, thank you so much. And the book, I want to make sure parents know where they can get the book. Is it available on Amazon?
It is available on Amazon.
Okay. Can you give the name again?
Sure. It's called Cannabis Revealed: How the World's Most Misunderstood Plant is Healing Everything from Chronic Pain to Epilepsy.
Okay, great. And I'll have a link for you guys on the show notes, as well as a link to the Canna Center's website.
Right. And what I'd like to also just share with you is that starting in the next 2 months, we are going to be having seminars in we're moving my office, and we have a classroom in there. So we're doing seminars. So anybody who's in Los Angeles and wants to pop in for a seminar, you do have to sign up online. But also, we are getting the technology to be able to do webinars.
Great.
And so people can sign up, and it's going to be everything from cannabis for your animal to the intricacies of the endocannabinoid system. And the goal is to educate everybody, from parent to adult children of people with Alzheimer's, to doctors, nurses, anybody in the healthcare field. So that's one of the goals. So everybody, that'll all be available on the new Canna Center's website, which is being worked on right as we speak.
Love it. Well, please keep me posted on that, because I'd love to share that out for my listeners and all my followers, so that they can get in on all that great information. And I thank you so much for joining us today and sharing that information. It was fascinating to me. So thank you to Dr. Goldstein for taking the time out of her very busy practice and life, speaking and educating and sharing this important information with everybody. Thanks so much for joining us.
My pleasure. Have a wonderful day.
You too. And thank you to you guys for tuning in and listening to another episode of Kids Health Revolution podcast. And we will be back in the next couple of weeks with a brand new episode. Take good care.
Thank you for listening to Kids Health Revolution Radio. Before you go, take a minute to subscribe to the show and to become a free member of the Kids Health Revolution community. Lots of great people, information, and bonuses waiting for you at www.kidshealthrevolution.com. The information on this show is for information and educational purposes only and is not intended to diagnose, treat, or otherwise replace medical advice.